on one hand, we have the technology, which is great. On the other hand, all these technologies are still in the nascent stage, so a lot of planning has got to go into it to kind of give us outcome studies, and we are actually in the process of trying to devise national databases of outcomes. So that's one important issue. The second important issue is obviously access to healthcare, and with the newer regulations, with the healthcare issues that is coming up, none of the physicians really know how this is going to evolve over the next coming years. So having proper access is going to be very important. Third thing has got to do with insurance reform, and a lot of the practices that we are doing, we cannot offer to our patients because we get told that it doesn't have the scientific validity to offer these technologies to the patients, and it is quote unquote not FDA approved, or insurance is not going to cover it because it's investigational, so the insurance is not going to cover it. So what ends up happening with that kind of a situation is, because the patients believe in it and because the doctors believe in it, and you have a common meeting of the minds, you end up getting the surgery anyway or the procedure anyway, and you end up having either the patient bear the cost or the system bear the cost. So it has led to a situation which is less than optimal. Unfortunately, a lot of the technologies that are now evolving outside the United States. Specifically, I can give the example of the endoscopic discectomies that I was talking about. All the improvements are going on in Germany, in South Korea, and I feel that United States being the best and the biggest country of them all, these developments should actually be happening here, shouldn't be happening outside the country. And unfortunately that happens because we don't have insurance coverage. We don't have a situation that can lead us to have this develop in this country. There are too many barriers to having new technology come up.